Morning everyone. I, Pallavi Sharma, working as an assistant professor in rpiit campus. Today we are going to discuss about antipsychotic drugs. In recent videos, I discussed the introduction of psychopharmacological agents and today we discuss antipsychotic drugs. Antipsychotic drugs are also known as neuroleptic drugs, which are mainly used for treating schizophrenia. Schizophrenia is a major form of psychiatric illness which affects young people, is often chronic and highly disabling. However, they can also be used in mania. Mania is a condition of happiness, excitement of neurotransmitters, you say. So, what are the positive symptoms? Positive symptoms are thought disorders comprising wild trials of thoughts associated with the feeling that thoughts are interested or withdrawn by the outside agencies, delusions, hallucinations in the form of voices, and abnormal behaviors involving stereotyped occasional aggressive behaviors. So in this, the person may perform some activities like aggression. Next is negative symptoms. Schizophrenia give rise to the following negative symptoms: loss of contact from the outer world and flattening of emotional response. So the person will not respond to anything that happens outside. Now next, the classification. The classifications are, it is mainly classified like two types. The first is first generation, second generation, but according to potency they are low potency, high potency, and typical and atypical. There are so many names of this classification. So in first generation, or you say low potency drugs, these are chlorpromazine, prochlorpromazine, and thioridazine. So these are the drugs which we used as first generation. Now high potency drugs are haloperidol. Haloperidol is the most important drug. Mechanism of action will also come in your exams. Now second generation drugs like clozapine, paliperidone. These are the second generation drugs are having side effects like increase in weight and diabetes. They basically trigger the metabolic function of the body. Now next is the mechanism of action of these drugs. So the antipsychotic drugs will do like they mainly block the D2 receptor of dopamine. Dopamine have 5 receptor, D1 to D5. So antipsychotic drugs mainly block the D2 receptor. Okay. D2 receptor they will block. All the first generation and most of the second generation drugs do this. If we have to reverse the action of this D2 receptor, what will we do? Increase the dopamine in the body. So how we can increase it? By using levodopa or something that mimics dopamine like bromazepine. Right? Now let's is pharmacological actions. What are the pharmacological actions of antipsychotic drugs? On CNS, they decrease the irritational behavior, aggression, and decrease the disturbed thoughts. Disturbed thoughts means the person is not able to decide it is right or wrong, where he or she want to go, left or right. These anxiety level and hyperactivity. Our chlorpromazine, that is first generation drug, are also used as local anesthetics, but nowadays these are not used because they cause irritation. On CVS their effects are hypertension, decrease in BP, high dose depress the heart, may cause cardiac arrest. Endocrine system effects are increased prolactin release. They increase prolactin. Prolactin is mainly responsible for secretion of milk. So enlargement of breast, if over secreted, enlargement of breast may cause like gynecomastia. Right? We use antipsychotic drugs in treatment of schizophrenia, manic depressive illness, behavioral disorder in children's, antiemetic, anti-hiccups, or treatment of anxiety. Now the adverse effect. Adverse effect